Hi, Teresa Lyons here, creator of Navigating Autism and Eat to Heal Autism. And today's Ask Dr. Lyons question is, what drugs are used for sleep problems for those with autism? Let's get to PowerPoint. Okay, here we are in PowerPoint. What drugs are used for sleep problems? I do want to mention that this is an appendix to my free sleep webinar. In this Ask Dr. Lyons today, I will only focus on the drugs that are used for those with autism that have sleep problems. I'm not able to discuss all the other non-pharmaceutical options as well as strategy in under 10 minutes. So I created a full-length sleep webinar. Please sign up at my website to receive email notifications of these Ask Dr. Lyons videos as well as any of my free full-length webinars. Management of sleep disorders. There is very little high-quality clinical trial data on using drugs to help those with autism sleep. To date, the FDA has not approved medications to treat insomnia in pediatric patients, including those with autism. Sleep medications are prescribed off-label by your doctor, so make sure you have a knowledgeable doctor or healthcare practitioner that you're working with. I'll walk you through the considerations first, and then we'll get straight to the drugs. So a consideration when you're working with a physician, you want to talk to them about what the cause of the sleep disturbance could be. Is it really hard for the child to fall asleep at night? Is it that they fall asleep but they wake up at a very particular time every night? Are they awake in the middle of the night for 3-4 hours, or are they only awake for half an hour but yet get woken up every hour or two for half an hour? So it's really important to understand what the actual sleep disturbance is. The child's medical history and developmental age, pharmacokinetic properties of the medication. Pharmacokinetic just means basically metabolism, so how the body would metabolize any of the particular sleep drug that would be given. Available efficacy data, safety data, and potential drug-drug interactions. So if your child is taking any other medication, you certainly don't want to have a potentially hazardous drug-drug interactions, which can happen. These are pharmaceuticals that we're talking about here. There are no treatment algorithms for the physician to just prescribe a medication. So again, this is all off-label usage. So you're relying a lot on the knowledge of the physician that you're working with. So you certainly want to make sure that this doctor that you're talking to is very familiar with autism, as well as very familiar with any other issues that are going on with your child, as well as sleep problems. So how often does this physician prescribe medication? How much experience does he have with others with autism with a particular medication? These are all things to think about because there's no straight formula. There's no treatment algorithm for the physician to follow. Ramelteon, the mechanism is a selective agonist of melatonin receptors. An agonist just means that a physiological response occurs when that compound interacts with a receptor. It's a central nervous system depressant, and it works on synchronizing the sleep-wake cycle. It is FDA approved for insomnia, and you want to avoid taking it with high-fat meals. Clonidine, alpha-2 adrenoreceptor agonist. It works by activating inhibitory neurons, so you get a decreased heart rate, decreased vasomotor tone, and sympathetic outflow. Basically, it's a CNS depressant. It is an FDA-approved antihypertensive agent as well as for pediatric ADHD. You don't want to abruptly stop taking Clonidine, and avoid taking with tricyclic depressants or beta blockers. Gabapentin, it's structurally related to GABA, but it doesn't bind to GABA receptors. It's FDA approved for partial seizures and neuropathic pain. For the neuropathic pain, often it's used in those who have shingles and that residual pain from the shingles. So it's that nerve pain that someone feels. Be careful if your child is also taking magnesium or aluminum containing antacids. You don't want to stop taking it abruptly. Now, with gabapentin, there's an increase in daytime behavioral issues that has been seen, as well as weight gain. And another thing to think about with pharmaceuticals is the inactive ingredients. What else is in this pill that my child is taking? And so for gabapentin in the capsules, there's actually lactose, cornstarch, and talc. Talc isn't all that problematic if someone's following a special diet, but lactose and cornstarch are both problematic if your child is following a special diet. So make sure that you understand what inactive ingredients are in your pharmaceutical, as well as the actual pharmaceutical itself. Trazodone. Trazodone is actually a 30-year-old antidepressant that causes drowsiness as a side effect. It inhibits the uptake of serotonin and also has antihistamine activity. It's very effective for the first 3 weeks, and after that, the side effects of drowsiness and using it for a sleep aid, it really wears off. So it's a very short-term solution. A serious side effect is serotonin syndrome, which means your child might exhibit agitation, hallucinations, problems with coordination, fast heartbeat, things along that nature. What else? There are other medications that also have sedating properties that can be used off-label. And again, all these pharmaceuticals are used off-label. Risperidone is FDA approved to treat autism-related aggressive behaviors. So many of your children might be on risperidone. And one side effect is drowsiness. So if your child is having aggressive behavior problems as well as sleep problems, risperidone might be a fantastic short-term solution. I say short-term because most times when the drug is stopped, the problem returns. So drugs could be a part of your short-term strategy for your child's sleep. But long-term solution is to heal and rebalance the gut using special diets. I hope you use this information as a starting point to talk to your physician about potential drugs, if that's what you're thinking about. I don't judge how you heal your child. I want you to have all the options available so that you and your child could get a great night's sleep.